Mr. Andrews?
Yeah, it is.
Hello, sir. My name's Jack Baldwin. I'm one of the doctors in the clinic today.
Yeah.
How would you like to be called?
Simon's fine.
Brilliant. Pleased to meet you, Simon.
You too.
Is it alright if I take a few notes as we go?
Yeah, absolutely. That's fine.
Superb. What's it that's brought you to clinic today?
I guess it's been issues with my asthma, really. Had a really bad cough and symptoms around that recently. That's kind of concerned me.
Okay.
Yeah.
But I suppose first off, how long have you had asthma for?
I've had it since I was a kid, so about 6, I think. Yeah.
Okay. And how long has it been giving you extra grief for?
About 2 months now, I would say.
Okay.
Yeah. So 2 months ago is when it really started to get really, really bad.
So what have you noticed?
Coughs, like really bad coughs at night, that would wake me up. And also, I've been getting really wheezy in the mornings as well. Yeah.
So 2 months ago.
Yeah.
Had you had any trouble with your asthma before then?
No, it's just pretty much manageable with my inhaler. Yeah.
Okay.
Yeah.
So how would you? What inhaler would you normally be using before all this got worse?
So the blue inhaler, I believe it's called salbutamol.
Yeah, that's right.
I remember my GP saying that anyway. Yeah. So I just use the blue inhaler. So when it's really cold outside or just before I exercise, I take it just so I don't have any attacks, basically. Yeah.
Okay. So you'd normally be fairly well managed on just the blue one.
Yeah.
And how many times a day would you be using it, do you think?
It just depends really how much I'd need it, but I don't really. Yeah, so I just probably take 2 puffs. So say I'm about to play a game of football, just take 2 puffs and I'm fine.
Okay.
Yeah.
But then this all got a bit worse 2 months ago.
Yeah.
You mentioned that you've been aware of coughing during the night.
Yeah.
And feeling a bit wheezy in the morning.
Yeah.
Did that come on suddenly, or did it just sort of progressively?
It came on. I just thought it was a chest infection from my young daughter. So I went to the GP about 1 month ago now, and he just gave me a brown inhaler and told me to start taking that one.
Okay.
Yeah.
So you've got a young daughter?
Yeah, she's 2.
She's 2.
Yeah.
Okay. And was she a bit unwell?
Yeah, so she had a bit of a bug or something. Yeah, so I just thought I'd call something from that, really.
And it was round about then things started to get worse for you.
Yeah. So I thought it was that, but anyway, my GP said it wasn't. So yeah.
Okay. And when you were coughing, if she had a bug, were you aware of being productive, bringing up any phlegm?
No, not really. I just knew that it was really, really bad. So and constant as well, especially at night. Yeah.
And did you have any fevers?
No, I didn't have fever. No.
Okay. So you rode it out for a couple of weeks.
Yeah. Then went to see my GP.
You went to the GP. Yeah. He starts you on a brown inhaler.
Yeah.
Do you know the name of it?
Beclometasone. Is that right?
Okay.
Beclometasone. Yeah, something like that.
And so how did he tell you to?
Twice a day, yeah. So I started taking that one twice a day, yeah.
So you've been taking that regularly, morning and night?
Yeah, so I take 2 puffs in the morning, 2 puffs at night. Yeah.
Okay. And did that help?
Well, I would say for 2 weeks, after my symptoms improved, and then it's been a lot worse since, I would say. Okay. Yeah. So now I just feel it's quite terrible, especially with the wheeze and everything. Yeah.
Okay. And when are you feeling wheezy?
Now, before it was like just in the mornings, but now it's all the time, and especially when I'm at work as well, I feel regularly short of breath. Yeah.
Okay. And are you still using your blue inhaler as well?
No, I've kind of stopped using that now because obviously I'm using my brown one. I've not played any sports recently for me to use this. I just thought, okay, I probably won't need the blue one because I just take that as and when.
Yeah.
But the brown one I've been pretty much consistent with.
You've been good at taking it, but you've still just been feeling tight-chested and
so now the wheeze is all the time as opposed to just in the mornings, which is quite concerning.
And are you still getting affected during the night?
Yeah, it's that bad that my wife has had to move into my daughter's room basically because it keeps waking her up as well. So
okay, clearly having a big impact.
Yeah.
All right. Just a few more questions about your asthma, if that's okay. Yeah. Have you ever had to go to hospital with your asthma?
No, I haven't actually.
Okay, so you've never sort of had to go into intensive care and
No,
like that? No. Oh, okay. And you said you was diagnosed when you were 6.
Yeah.
Do you know how that diagnosis came about?
Oh gosh, I don't remember. That's my mum. Yeah, sorry.
But they started you on a blue inhaler and that helped you.
Yeah, initially, yeah.
Have you ever been asked to do something called a peak flow?
Oh yeah. So initially, when I was a lot younger, I did it, and then a couple of years ago as well, I did it, but I've not really been good at keeping it. Yeah, like doing it consistently.
Okay, so you've got no idea what a
I don't know
normal score for you is.
No, not at the moment.
No worries. So you've told me about having the tight chest and that you feel similar to your asthma. Initially a little responsive to the brown inhaler. Have you noticed anything else?
No, I think that those are the main symptoms that I've kind of been concerned about recently. Okay. Yeah.
Have you had any pain associated with it?
No pain.
Okay. Yeah. I've got a few other questions I'll just rattle through just to make sure we're not missing anything out. Have you been aware of any sort of your heart racing or doing a funny rhythm?
No.
Have you been aware of any tummy disturbance, any diarrhea, and nausea, anything like that? No. Have you been aware of having any confusion?
No.
Ever had any seizures?
No, I haven't. No.
Nothing like that. Any rashes?
No.
Any eczema or psoriasis?
No.
Anything like that?
No.
Okay. And how's your weight been?
My weight's been fine. Yeah.
And your appetite?
Yeah, my appetite's been fine. I've had no sort of issues with that, I would say. Yeah.
Okay. Yeah. Now, you've told me about the asthma since childhood.
Yeah.
Have you got any other past medical history?
No, just asthma. Yeah.
You don't see any other specialist doctors?
No, I don't know.
And apart from the beclomethasone and the salbutamol, do you take any other medicines?
No, just those two.
And do you have any allergies, sir?
No, I don't know.
Brilliant. I think it's good to get a bit of a picture as to more of your background, your social life.
Sure, that's fine.
Do you smoke at all?
I don't know.
Have you ever smoked?
I haven't, no.
Brilliant. Do you drink much alcohol?
No.
Okay. Now, what do you do for work, sir?
I'm a painter and decorator.
Okay. Have you always been a painter and decorator?
I've been doing that for 5 years now. Yeah. Okay. Quite some time. Yeah.
And previously, the asthma's not had any issue?
No, I mean, do you mean at work?
At work, sir.
Yeah. When it's dusty or anything, I do the wise thing of wearing a face mask, and then I'm fine. But like I said, recently I've been getting a little short of breath at work as well. So, but in the past it's just been just put a face mask and I'm good to go.
And has anything changed at work recently?
I mean, I have been working on a massive renovation project for the past 4 months or so. Yeah, about 4 months. So. Maybe, I don't know.
Is that particularly dusty?
Yeah, it is, because obviously it's a lot of revamping and, sort of starting everything again from the ground up. So it can get a little bit dusty around.
Is there much paints or solvents around?
There is a lot, yeah.
Okay. But do you still use the mask?
Yeah, I do, yeah.
Okay. And you've not had any trouble with that previously? Well, with like solvents and paints?
Yeah, especially if there's paint and if it's dusty, I just put on a mask and I'm fine. But even with the mask, I still get a little bit, short of breath.
Okay, coming.
Well, I imagine it's not the best
career
for a gentleman with asthma. What's your home life like?
Currently?
At the moment,
yeah, it's fine. My wife, she's a full-time mom, and then obviously I have a 2-year-old daughter.
Okay.
Yeah.
And are there any pets at home?
No pets.
No birds?
No.
Okay. Where do you live? Is it a house? Is it a flat?
No, it's a council flat.
Okay.
Yeah.
And any changes there recently?
Actually, 3 months ago, the council started, because of a damp problem, they started a lot of work, in the flat and around the flat as well. So they started, renovating it and doing some construction work around, because there's been damp issues.
Okay. Has there been any bits of mould or anything like that?
Not that I've seen, but my wife has seen some. So I know they're around somewhere.
Okay. And when did all that start off?
So they started it 3 months ago. Yeah.
Okay.
They started the issue 3 months ago. Obviously, I think the issues with the damp has been sort of going on before then. Shortly before then.
That's only when the council started doing the work.
We noticed it.
Okay. And is there any family history, your parents or siblings, anything seems to run through the family?
No, not that I know of, no.
Not you aware of? Okay. So just to recap, it seems like your asthma's been particularly giving you a bit of grief over the last 2 months.
Yeah.
You'd describe it as tight-chestedness, which at the moment's there all the time. Sometimes at work you're feeling a bit more short of breath.
Yeah, exactly.
And you've been aware of a cough during the night.
Yeah.
And it's getting so bad that your wife had to actually go and move the daughter.
Yeah.
Is there anything else which you think of?
No, I think that's it.
Okay.
Yeah.
Is there anything you're particularly worried that all this could be?
Yeah, I mean, I just hope my asthma isn't getting worse, I would say, because obviously I've been able to manage it up until, 2 months ago. So yes, I just hope it's not my asthma getting worse or getting the best of me.
Okay. Actually, one question I didn't ask. Have you had any recent travel anywhere?
No.
Any holidays out of the country, anything like that?
No.
Okay. From what you've been telling me, it does sound like it could well be your asthma, which is giving you some of the trouble you've been reporting.
Okay.
Obviously, I do want to have an examine of your chest and things.
Okay, yeah.
But I suppose the real question is, why are things getting a bit worse? And I think that's what's going to take us a little bit of time to uncover.
Okay, yeah.
There's a few bits and pieces I'd like us to do here today.
Okay, yeah.
Part of that is we'll make sure we get a decent peak flow meter, see what your reading is today.
Yeah, sure.
And if we're able to, we'll do some other breathing tests, which gives a bit more information.
Okay.
What we'll do following that is I'll give you something we call a peak flow diary.
Oh, yeah.
Is this ringing bells?
Yeah.
Because I think what's really important would be to see
you have
how
2 minutes
your
remaining.
flow sort of changes during the day, and if there's a time that's particularly bad, and see if we can try and find out what is precipitating this.
Yeah, sure.
And particularly seeing between daytime, the week and the weekend, we might be able to see if there's a change between being at work and things.
Yeah.
We'd like to do some blood tests as well.
Yeah.
That will basically be some allergy tests I want to do to try and see if there's anything we can identify as triggering this, making it get worse.
Yeah.
In the interim, I would like you to use your blue inhaler as well.
Okay. As well as the brown one.
As well as the brown one.
Yeah.
Now, do you know what dose of the brown one you're on?
Oh, no, I don't know. Sorry.
Don't worry. Well, I'll get in touch with your GP, and I think there's scope for us to increase it. Just because if you're telling me you're feeling tight-chested all the time, I think we need to make sure. But what we can also do is use that blue inhaler during the day as well, because that will hopefully give you a bit of relief from some of these symptoms.
Yeah, okay.
And what I'd like to do is bring you back to clinic in 2 weeks' time.
Right, okay.
And we can try and put the blood test together, put your peak flow together, and we might be able to see where we're going from there.
Yeah, that's absolutely fine.
Does that sound reasonable?
Yeah, that sounds very reasonable.
And do you have any other questions for me?
No, I think that's everything. Yeah.
Brilliant. Thank you very much.